Obamacare wants to be repealed by pretty much anyone that's Republican.
Yeah.
That's probably what they're leading in with their politics is, for the election that's less than a month away. Why do they want it out? Is it besides them just being Republicans and not liking Democrats?
Yeah, well, that's a big part of it, quite honestly. I mean, anything that a Democrat likes, a Republican's not going to like, and anything a Republican likes, a Democrat's not going to like right now.
Which we can talk on a whole other show about.
Yeah. But I think that's the primary thing.
Okay.
There is not, because there are parts of it. Even Romney came out and said, "Hey, I like the pre-existing condition. I like the staying on until age 26." But basically, what we've got is a philosophical difference in how to address health care. The Obama approach is using an approach that has been used and actually succeeded in many other countries in the world, of basically saying collectively healthcare is now a public issue that we need to address as a country. No longer is it just, in which I tend to agree with, because again, it's impacting our debt, it's impacting our taxes, all of those types of things. The Republican approach, and part of the problem that I'm waiting for, because again, I'm trying to be balanced. I'm trying to say which one would work better. The Romney approach has been very good on the talking points, very lenient on the specifics.
Okay.
So it's
talking
basically
the big
saying,
game, but not backing it up.
but not saying, okay, and here is how I would do this. So it's repealing it. And basically, what Romney is talking, what the Republican side is saying, is we want to rely on the free market. We don't want the government coming in and telling us how to do this.
Now here's the question.
All right, we're being joined by Bart Meyer now.
We have a new addition here.
So now he skirts around the big thing is the pre-existing conditions, right?
That's one of the
That's
things.
one of the many things, right?
Yeah.
And so now I had to deal with pre-existing and Blue Cross turning me down.
Yep.
Honestly, like for which is, and my family has funneled money into Blue Cross for years in North Dakota, and they turned me down for a surgery that I had to go through a insurance company, Aetna, out of the East Coast.
Yep.
Because they were willing to pay, and Blue Cross wouldn't even touch me, which
Yep.
was fascinating to me.
Yeah.
And so many vile things wanted to come out of your mouth. Now, Romney's latest thing was saying that he would let this, he said, oh, he'll keep it. And then his camp comes out and says, well, we'll let the states decide. So how many people do you think are actually going to,
Well, one of the things
would
to
take
keep
it
in
out?
mind, the Romney approach has said, I want to keep the pre-existing condition thing of Obamacare as long as you had health insurance before. If you didn't have health insurance before, Romney is saying, nope, you aren't going to be included in it.
He's not explaining that.
Yeah, so so that's one of the big things, and I have a question with it also, because he's been very clear. As long as you had health insurance, yes, pre-existing conditions are waived. If you didn't, we're still going to have a large group of people out there with pre-existing conditions who never had health insurance, who are still going to be trying to access the system.
They're going to be screwed.
They're screwed, right?
Yeah.
Yeah.
And which is odd because, and not to rip on Romney, because actually this Obama there's many parts of it that come from what he did in Massachusetts.
Oh, absolutely. and what's interesting, when you look at Massachusetts, they are dealing with, because they've got like 95% of their population now all have health insurance.
Yeah, it works.
But their costs are the highest in the country.
Okay.
So they're doing exactly what I was saying, is they brought all these people into the system and into a broken system. They didn't fix the delivery side. Now they're actually trying to address the costs.
Makes sense. Okay.
Yeah.
I see what you're saying. Okay. So and I agree with you what you were talking about. I mean, it is a colossal mess, and it needs to be, and that is driving up, everything. I mean, how many people that go to the emergency room have no insurance, and that's their thought process. They go, I'm just going to the emergency room.
Yep.
They have no insurance enough. They're not going to pay for it ever.
At $1,000 a crack.
Yes,
That's
and they have
the
no
average
plans.
cost is $1,000.
They have no plans on. When I was in the emergency room for a shoulder thing 2 years ago, you have no idea how many people were in there for. My ankle felt bad.
Yep. Yep.
But if we don't, as Americans, take care of that,
I
won't
agree
that
with
lead
you.
into more issues down the road?
Well, one of
agree.
the things,
I
though,
agree.
and this is something a lot of people don't see either, is originally the intention before the Supreme Court decision was to have everybody included. That was the individual
Yeah.
mandate. That's what happened in June, and the Supreme Court said, yeah, we'll go along with it, but you don't call it I forgot the word, it is a tax.
Right.
But it also, now there's a lot of states that are saying, I think Florida, Louisiana, Texas, and there's a couple others that are saying, we aren't going to participate in Medicaid, the Medicaid expansion. And so now, and one of the reasons hospitals were willing to take, because you hear this $715 billion number that Obama's
Yes,
taken out of
right.
Medicare, what that is, a significant amount of it, probably 60 to 70%, is reduction in payments to insurance companies. Because insurance companies were making out very well on what they call Medicare Advantage, the combination
Right.
of Medicare A, B, and et cetera. And so they were saying, no, we're going to cut that payment. The other payment they cut to hospitals is the compensation, the additional compensation that they would get for covering people without health insurance. Okay, but so now when there are some states out there saying we aren't going to do this Medicaid expansion, most of the people who go to the hospitals for emergency rooms have access or are using Medicaid. These hospitals are sitting there going, you're cutting my payment and I'm not going to be getting reimbursed for it again.
Right.
So it's all of this. That's where I was saying, Andrew, that the communication on how all the pieces fit together
Yeah.
has been really poor.
And could you just say, it almost sounds like part of what we were talking about before, where someone's in the hospital, doesn't have insurance. So the fact that America is a melting pot and the land of opportunity, didn't we kind of bring this on ourselves? And maybe you could blame it, over 200 some years ago when we revolted, Revolutionary War, come over here, blah 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 blah. 200, almost 30 years later, we fought for that 230 years ago. Now also we're saying, hey, this isn't good because it's costing us too much money.
Sure. I mean, I think. Yeah.
I'm not sure. Wait, ask that again.
Well, just saying that the situation we're in right now
Yeah.
isn't, it sounds like, allowing people without medical insurance to receive medical help.
Yeah.
Didn't we bring that on ourselves? And couldn't we blame that back to the 230 years ago when we revolted and said, hey, we're not going to stand up. We're going to stand up to the government. We're not happy with the way we're being treated. Now the United States has become a big melting pot. All immigration, migrant, all that stuff. Everyone's coming here, land of opportunity, want to be treated well, get better treatment than they've had at their own in their native country.
Right.
That builds 230 years. Now also we're trying to change it.
Well,
Didn't we create this? Didn't we create this monster ourselves?
Yeah, we absolutely created it ourselves. But the fact is that a lot of the people who are getting hurt in healthcare right now, because again, hospitals are required in the emergency room, if you don't have, and it's an emergency situation, to take care. They can't turn people
Yep.
away. But that doesn't mean that a $80,000 hospital bill for somebody who doesn't have insurance, somebody, and that's the big thing people need to understand too, somebody is paying somewhere down the road. Right now, let's go to Medicare, for instance.
Yep.
On average, during your lifetime, you will pay in about $130,000, $140, somewhere around in there, into Medicare. Okay? On average, you're going to get back about $250,000 to $260,000 in healthcare expenses. So one of the solutions could be, because people in Medicare go, well, I paid into this all my life. Okay, we'll pay you what you paid in plus a good return, but anything over that, you're on the hook for. I mean, it's shifting the cost back to, now could you imagine what the seniors are going to say by doing it that way? But the fact is, people think that because they paid into Medicare, that their
Entitlement.
yeah, it is an entitled to whatever the costs are going to be. As our costs have increased, we just cannot afford, and that's debt. I mean, that additional $150,000, $200,000 we're paying for as taxpayers out of our debt. So, I mean, that's one alternative for it. But at the same time, if we got everybody into the system and into the pool, because right now, you look at Medicare, that's probably very close to what we've got in some of the other countries across the world, okay? Because it's government pricing and all of that stuff. We've got Medicaid, which is very similar. We've got the VA, very similar to the National Health Services in Britain. We've got our private market, very similar to the German system. So we've kind of meshed together all of these different countries thinking, oh, this is going to be more efficient.
Something's got to work. Okay.
Yeah.
All right, well, we'll end it right there. I want to thank Michael Zignick for coming in here. Check out every week, Monday and Wednesday, our podcasts, our shows start at 2:30, go till 3 o'clock or beyond. You can check us out on iTunes, blogtalkradio.com, Facebook, Twitter, all the social medias out there. Please join us on the show as well, 646-595-4014. I am your host, Andrew Kagol. Have a great week, everyone.